So my name is Mike Bannon. I'm one of the athletic trainers through the Lehigh Valley Health Network. Today we're going to go over some exercises for the hip and knee. First two for the calves, it's going to be a gastroc stretch and a soleus stretch. So the gastroc stretch, you're going to have the leg that you want to stretch up against the wall, and you're going to move your body towards the wall until you feel a nice stretch on your calf. Hold for 30 seconds. You're going to do it 2 or 3 times. Now, in order to do the soleus, we're going to have you bend your knee just a little bit, about 15 degrees, and do the same thing. You're going to lean into the wall. You're going to feel this one on the more of the outside of your calf, more than directly in the back. Same thing, you're going to do 2 sets of 30 seconds. So working our way to the front of the leg, we're going to try to stretch out those quads a little bit. So what you're going to do is you're going to stand up, you're going to bend the knee that you want to stretch, you're going to grab your forefoot, and you're going to pull towards your back. You're going to hold it 30 seconds, do it 2 or 3 times. So time for some hamstring flexibility. What you're going to do is you're going to have the hamstring that you want to stretch with that leg straight. You're going to have your toes towards you. You're going to keep your other foot out of the way. The easiest way to do that is to bend it and rotate your hip out. And you're going to reach for your toes. You're going to pull and hold for 30 seconds. And you're going to do it 2 or 3 times. So we're going to do 2 stretches for the hip and hamstring with the stretch cord. If you're at home and you don't have a stretch cord, you can use a dog leash. That's one of my favorite ones to use, or you can use a towel. So you're going to have the strap up around your foot. You're going to pull. You want to focus on keeping your other leg nice and straight on the table. Try not to let it pop up off the table. You're going to pull until you feel a good stretch in your hamstrings. You're going to hold it for 30 seconds, and you're going to do it 2 to 3 times. While you're here and you want to stretch out your IT band and your low back a little bit, pretty much the same motion. This is one of my favorites for our kids. Then you're going to drop that leg over to the side, and then you can focus more on the side of the hip. And then the more you drop it over, you can stretch out your low back as well. Same thing, you're going to do 2 to 3 sets of 30-second holds. First one, just to get your muscles firing again in your leg, is called a quad set. So you're going to put a towel underneath your foot or a pillow, whatever you have readily available. You're going to keep your leg nice and straight as it can go, and you're going to fire your quads and make a nice muscle. Hold it for 3 to 5 seconds and then relax. So you'll do 3 sets of 10 of that, and that's just to get the muscles firing again. So after you injure your knee, you're going to be a little bit stiff. So in order to get some motion moving, you're going to sit on a chair or the edge of your bed, and you're just going to kick your knee out as far as you can go. Good. You're going to hold it for a second or 2, and then you're going to try to bend it all the way. Good. This one you can do either 3 sets of 10, or you can really do 30 in a row, just nice and slow. Hold it at each end point for a second or 2 just to get some of that motion back. All right, so a good basic exercise to strengthen up your hip and your knee is 4-way straight leg raises. So what we're going to do is we're going to have the uninjured leg bent to help maintain good body mechanics. We're going to have her toes towards her, keep that knee nice and straight, and we're going to lift to right about here, hold it for a second, and then go back down. Good. So that's something we're going to do 3 sets of 10 for that. After that, you're going to rotate to either side. Okay, so this one, we're going to have the top leg, and we're going to go up and over. And then you're going to do the same thing with the injured leg. You're going to lift your leg up to the table. Good. This one's not going to go as high. This motion's a little bit harder. Once you're done 3 sets of 10 of that, you can lay on your belly. And then do the same thing. You're going to lift your leg up in there. Good. Back down. This one, you want to make sure you're focusing on, a lot of people are starting to use their back, so she's doing a pretty good job right here, not using her back, and you want to make sure you're focusing on using your glutes. After that, you'll finish do the last motion, so you're going to lay on the other side. So I'll have the face away. And then you're gonna go straight up to the side. For this one, you wanna make sure your toe's not rotating out. You wanna keep it nice, your foot nice and straight, up and down, nice and slow. These are ones, if you don't have a weight at home, you can do a good 3 to 5 second hold and then go back down. All of these are gonna be 3 sets of 10. Okay, so next we're gonna do some bridges with a ball squeeze. If you don't have a soccer ball or basketball at home, you're more than welcome to use a pillow or fold up a blanket. So what we're gonna do with the ball is we're going to put it right in between their knees. You're gonna have them squeeze the ball with a moderate amount of resistance, and then you're going to have them do a bridge. So they're gonna lift their abs and their body off the table. Good. Gonna do 3 sets of 10 with a nice 2 to 3 second hold when you're up at the top. Next thing you're gonna do is you're gonna do another set of bridges, but this time you're gonna use a band. This is something you can get from your athletic trainer. I'm sure they'll be more than willing to give you one to do these exercises at home. So what you're gonna do is you're gonna keep your knees shoulder width apart, and you're gonna do bridges again. So this is gonna work the outside of the hip, whereas the other one worked the groin muscles. Same thing, you'll do 3 sets of 10, just nice and slow with a 2 to 3 second hold at the top. All right, so our next exercise is gonna be a squat. For the rehab purpose, you wanna make sure you have really good form. So that's why we utilize a chair. If you're at home, you can use a kitchen chair and then be in front of the counter so you can hold on in case you feel unstable. So what you're gonna do is you're going to do a squat down into the chair. You wanna make sure you have good form. Your knees aren't bow-legging out or anything, and your knees are not going over your toes. The reason the chair is there so that if you get stuck while you're down there, you can sit and you're obviously not falling back. Okay, so this one's gonna be a little more difficult. It's called a RDL, or a Romanian deadlift. So what you're gonna do is you're gonna stand on your injured leg, and you're going to go down to the ground, touch the ground, and go back up. This one's going to work on some balance as well as strengthening of the hamstrings. Another one, if you want to have somebody with you just in case you lose your balance. If you don't have anybody with you, do it near a counter or something that you can grab onto in case you're going to fall. Following exercise is going to be alternating lunges. So what you're going to do with the bad injured leg out, you're going to go forward and back. And then you can alternate to the other side. For these and the RDLs, you're going to be doing 2 to 3 sets of 10. What we do in our athletic training room for the lunges is each time both legs go is 1. All right, so one of the last things we're going to do is some basic balance. So what you're going to do first, we're going to do a tandem stance. So that's going to be 1 foot in front of another. And you're just going to stand like that, looking forward. This is something where you're going to want to use your counter or something at home in case you do lose your balance and we don't want you to fall. So you're going to keep your head forward. You're going to stand there for about 30 seconds. You're going to do that 2 or 3 times, and then you can switch your legs around, and it gives it a little bit of a different difficulty. When you're done them, you can go into a single leg balance. So you're going to stand on your injured leg. Make sure you only do this if it's not too painful, where you're going to stand on the injured leg. Same thing, you're going to do it for 30 seconds, and you're going to do it 2 to 3 times. When you're done that, if you want to, you're more than welcome to do balance on your other leg as well.